Welcome to Micro Health Talks, where we bring insightful discussion on all things health and wellness. Are your kidneys okay? On this World Kidney Day, we would love to throw some light on our often overlooked kidneys. Joining with us today is Dr. Vijay, clinical pathologist and medical director at Micro Health Laboratories. Doctor, welcome.
Thank you very much, Ms. Alka, for the introduction.
Dr. This World Kidney Day, to start with, can you explain about kidneys? Let's start with some kidney conversations.
Okay. So first of all, a very happy World Kidney Day to everyone around the world.
Thanks.
And it's like talking about our kidneys. So kidneys, as you know, they are a very complicated organs, but they are an amazing pair of organs where, it is like they do most of the routine essential activities to make sure that, we are kept healthy and fit. So one of the most important function of kidney is to excrete the toxins and is to excrete the water, excess water from the body, and it also helps to regulate the body temperature, and it also helps to make RBCs inside our body, and they play an important role in homeostasis.
Okay.
So kidney has got a varied and it's a very complicated function, but provided we take proper care of our kidney, so we can actually be very fit and we can be very healthy also.
Dr. 9 among 10 adults globally are unaware about kidney health or the importance of kidney health.
Yes.
So, Doctor, why do you think kidney health is very crucial?
Okay, so kidney health is very crucial because just like your diabetes, hypertension, kidney disease is a very silent disease.
Yes.
So it is like when the kidney function is until 75% or till 90%, none of them have any symptoms or any signs of any problem with the kidney, which is manifested.
Okay.
So this itself is a major thing because it is like until the kidney gets failed more than 75%, so it doesn't get manifested.
Okay.
So it's a very silent disease. So out of 9, 9 out of 10, whichever you have mentioned. So it is like as per the statistics from the world, there is a thing called chronic kidney disease. So around 850 million people around the world are affected by chronic kidney disease.
Okay.
That means, wherever there is a progressive loss of kidney function, they progress to something called chronic kidney disease. So if proper intervention is not being taken at that point of time, so they fail. And it leads to something called kidney failure. So this is very important because if correct intervention is not being done at that point of time, they can lose their kidneys.
Okay. Doctor, as you told, kidneys are called the silent killers because the symptoms are none or less. Doctor, how we can detect it? What are some of the kidney function tests or investigations that you would advise?
Okay, so before going to the kidney function test, so let us talk a little bit about our signs and symptoms, which can be taken as alarming factors. So when it comes to kidney, as we already discussed, it's a silent killer, but still, there are some pointers to make sure that, we are being aware of those things.
Okay.
One of the earliest thing which can happen is excessive fatigueness.
Okay.
Your tiredness. And these two are very important thing and it should not be taken lightly. And there can be loss of appetite and there can be loss of weight. These are generalized symptoms, but still they can point a little bit more about our kidney health.
Okay.
And likewise, the person can have swollen ankles, swollen legs, and the patient can have breathlessness. And these are also alarming symptoms, and it's like they also point towards kidney disease. And specifically, when it comes to urine, the patient can have frothy urine or the patient can have blood in urine. So we have to pay attention to all the symptoms and signs, and we have to make sure they are being taken seriously, and then I think we have to start investigating accordingly.
Okay, doctor. So at this point of alarming, we can start this investigation. What are the investigation process that you would advise, doctor?
Okay. So there are basically 3 types of investigations. So how we can actually go about. One is your general investigations. The other one is your specific investigations. And the last one is your special investigations.
Okay, doctor.
So general investigations comes to it is like routine measurement of your blood pressure. So where we detect hypertension. That is one of the most important things. Second thing, we can look for blood sugar levels, either in the form of glycosylated hemoglobin, fasting blood sugar, or maybe random blood sugar, and detecting or measuring the BMI, this is also a very important factor which will help us in knowing a little bit about our kidney health. The second part is your specific test.
Okay.
So there is something called a renal function test. So where we detect or detect the function of the kidneys. So with the help of few blood tests, these tests are actually simple, effective, and they are effective, cost effective, as well as it is like it is available everywhere, which can be done. So one is your blood urea levels. The second one is your serum creatinine levels, and it can be in the form of maybe even blood urea nitrogen also. Sometimes we can test for uric acid levels.
Okay.
And we can do a simple urine routine test. But just by doing a simple urine routine test, we will be able to know, how our kidneys are functioning to some extent. So there are other tests like measuring your urine microalbumin. So one thing about urine microalbumin which I wanted to mention was whenever the kidneys function properly, it is not usually manifested by any signs or any symptoms. But whenever there is a problem with the kidney and there are no signs or symptoms in any of the patients, so there are few tests and which will actually help us in knowing or predicting the kidney function a little bit earlier. So one such test is your urine microalbumin.
Okay.
So this is nothing but a protein which is actually detected early in urine whenever the patient has got any problem in kidney. So routine testing of urine microalbumin and making sure the microalbumin levels are very well within the limits is a very important factor to assess our kidney health.
Okay.
And there are tests like urine microalbumin creatinine ratio, which can be an add-on for all those tests, which can help us in knowing a little bit more about our kidney. And as I mentioned about the special tests, some special tests which include your renal ultrasound, which can be done, and your CT MRI, which can be done, and there are specific glomerular function tests which can be done
as well.
And these tests will help you additionally to know more about the kidney health. And as a last resort, there is a test called kidney biopsy also. When we suspect something very serious about our kidney. So we can do something called kidney biopsy under the close consultation of a nephrologist or a neurologist. And if something is being found, and definite proper intervention has to be taken
at the right time.
Yes.
Yeah. So, doctor, there are a lot of misconceptions about kidneys.
Yes,
so,
yes.
what are those? And like people are having so much misconception, like they still consider it as a taboo. For example, kidney stones. People still go for some traditional methods to rule out it.
Okay, so it is like people are so much used to this traditional method, and it's like it's an appreciable thing, but still, it is like as per allopathy as well as modern medications. So it is like kidney. There are scientific. It has been scientifically shown that it is like once you do something very scientifically to it, only then that will get properly addressed. So coming to the taboo, your the kidney stones and other things. So if people resort to traditional methods, but still, if proper scientifically it's not being proven, then it can complicate. Maybe they might get treated at that point of time, but it might come again in a bigger form.
Okay.
So once it comes up in a very bigger form, then it's like it is even more difficult to tackle it. So I think it's better that people resort to more modern methods and more scientific methods and more proven methods, so that they don't get affected by their disease.
Okay. So, doctor, like you have advised us on what are the symptoms, what are the investigation methods. Doctor, would you like to educate our viewers about tips to keep a kidney healthy, or what are the preventive measures they have to undergo?
Sure, definitely. So there are some high risk groups who need to be properly monitored when it comes to kidney disease. One is your people with diabetes, people with hypertension, people with cardiovascular disease, people with obesity, and people who have a family history of any kidney disease. They also, need to take proper care of their kidney. And it's like, so whichever categories of people whom I have mentioned, so they have to, properly investigate. And it's like the investigation has to be very regular and routine, and it has to be systematic. And if something is being found, they have to take it very seriously and make sure that it is being attended to at the right time. And coming to, I mean, tips about your kidney health.
Yes, yes.
So there are some golden rules for a proper kidney health.
Okay, okay.
So the first one will be your physical activity. So this is the first mantra, and it's like it is known to do wonders. And maintaining a proper physical activity and maintaining a proper physical health is essential for a very good kidney health.
Okay.
The second one will be your adequate hydration.
Hydration.
So this is also a very important factor when it comes to kidney health, because kidneys, the basic function, as we know, it's filtering out all the toxins. So if the body doesn't have enough hydration, it cannot filter out. And if it doesn't get filtered out, it accumulates inside the body, giving us complications. So this adequate hydration is also a very important thing which needs to be kept in mind. So ideally, a person should take around 2 to 2.5 liters of water every day to remain adequately hydrated.
Okay.
And if there is some problem with any individuals, for example, they already have some kidney disease or something, they have to check with their respective healthcare provider to make sure, I mean, how much amount of water is allowed for them and get themselves treated properly. Third thing is your proper diet. Maintaining a proper balanced diet is also very, very essential. And when I mean diet, it should include a lot of fruits, your vegetables, your lean meat. Lean meat is very, very important. That is your lean protein.
Okay.
So where it doesn't have that much of fat which is associated, that is called a lean protein. And adding more of grains, whole grains. So they also help to support our kidney in a very good manner.
Okay.
And controlling and maintaining our blood pressure, that also is a priority. Controlling and maintaining our blood sugar, that is also a very important factor. And avoiding smoking. Smoking is also one of the most important factors, I mean, which is known to affect kidney. So many people will ask, I mean, what is the relationship between smoking and kidney? Because both are totally non-related. But I can put it this way. So when we smoke, there are a lot of toxins and there are a lot of unwanted things which enter into the body. So they get accumulated in the form of toxins. So the kidneys are the only organs, or you can say along with livers, they help to detoxify the body.
Okay.
So if it is not being detoxified properly, then it accumulates and it causes detrimental effects to us. So smoking should totally be avoided. And there should be avoidance of alcohol consumption also. So like these, I mean, these are the golden mantras, I mean, which we can actually follow for a proper kidney health. And one more thing regarding medications. So many times, I mean, we have noticed people getting over the counter medications, that is called the OTC.
Okay.
without prescriptions. So they are the commonly available, that NSAIDs or your painkillers and other things. So if proper control over that is not being taken, so they self-medicate more. The problem is that, I mean, it is like it goes to an extent where it affects their kidney also. So painkillers are also one of the most important medications which can affect the kidney, and you should have a proper check on medications which you are taking there. So this is also a very important factor.
Okay.
So if we follow all these things properly, I feel we are going in the right direction. And as per our this year's theme, are your kidneys healthy?
Yes.
Definitely it is going to be healthy if you follow all those things.
Yes. Having said that, we would love to conclude this episode with a message rather than a question to you. Are your kidneys okay? Are you keeping your kidneys okay? So I hope you will all keep this pinpointed in your mind in all that you do, in all that you eat, and in all that you are up to. Having said that, winding up today is with Dr. Vijay, Micro Health Talks for Precious Life.